Hey everyone, and welcome back to my channel. If you're new here, my name is Nathan and I'm a 5th year medical student at UCL. If you watched my previous video, then you would know that I did it on how learning as a clinical medical student has changed as a result of the COVID pandemic. I split it into several parts and I talked about how we used to learn prior to COVID. I went on to explain what the medical school did in light of the medical school placements being closed and suspended. And finally, I talked about how this year has been affected and now that we're back on placements. And so this video is just going to be a short follow-up video to my previous one, because last Wednesday the medical school organized a really useful opportunity for us to practice key clinical skills, and this was in the form of a 3-hour session in which we were able to go into the clinical skill center and practice a number of practical procedures. So I explained in my previous video that one of the key components as a medical student that we have to learn before we become a doctor and we graduate is several practical procedures. We need to demonstrate that we're competent in these procedures, as these are things that we're just expected to be able to do as junior doctors. At the start of our 4th year, our clinical years, the medical school gave us this procedure passport, which contains several practical procedures that we're expected to get signed off, and you can even see a first year version of myself. And so some of the things that we're expected to get signed off include venipuncture, urine dipstick, being able to prescribe and administer oxygen, cannulation. So there's a whole range of clinical skills in this booklet. And the idea is that after you perform them on the ward and in the hospital, the doctor that supervises you or is with you can then sign you off. And that is obviously something that we are required to be in hospital to be able to do. And of course, with the lockdown last year and due to the pandemic and also reduced exposure this year, it's been harder to learn these skills and to practice these skills. So in my last video, I explained how whilst we are at home during half the year last year, the medical school is really helpful, and they provided us with a huge bag of medical equipment to practice some of these skills and to learn these skills in the first place. Because the way we usually learn them is we get taught them in a clinical skills lab setting, which is a safe environment. There's lots of human anatomy models, and then depending on the skill we can practice on each other, and when we feel confident we are able to go up to the wards and ask the doctors and the patients for permission to carry out these practical procedures on patients. By doing this many different times, it can boost our confidence and we can feel better prepared for when we become a doctor in doing these skills. So as I said, the medical school sent us a large bag of this equipment to study at home. So we had virtual classes, for example, on how to suture, but of course without any anatomy models to use. We had to use banana skins and we had to improvise, and the same with catheterization where we used a cucumber. In light of this, the medical school organized a really helpful session last Wednesday in which we were able to go into the clinical skill lab in self-directed study. So there was all the human anatomy models that are really useful for learning these skills, such as the fake arms, which have blood inside them, so you can practice taking blood from them, setting up a cannula on them, practicing catheterization on an actual actual model rather than using a cucumber was very helpful. So here are a couple of videos of what we got up to during the session, and I'll just talk through what we were doing during each of these.
So we use this spongy material to practice suturing, using this suturing needle here, and we also use these forceps and needle holders. This is a setup to practice intramuscular and subcutaneous injections, and this is just a cannulation that I set up in one of the arms that we use.
Thank you very much for watching. I hope you enjoyed this video, and I hope it gives you a more complete picture of how the medical school has tried to compensate for the lack of clinical learning that we had over the last year. If you enjoyed this video, then please like it and hit the subscribe button down below. Thank you for watching.